Welcome back to Houston Life. Turning now to your health. There's a brand new treatment option for back pain available right here in Houston. Good news, they accept insurance. You do not have to wait for an appointment. Joining us now is Dr. Ankur Khosla with AK Pain and Spine Center. Welcome back to Houston Life. Nice
Thanks so
to
much.
see you. All right, so last time you were here, you had some props to show our viewers, and we're just sort of getting to know you. What led you to work in this field? Because we've established a lot of us have back pain. This is very common for Americans. You essentially wanted to do something to help.
Yeah, so unfortunately we had a life experience within the family where one of my family members was dealing with chronic pain, and we went to multiple specialists throughout the city without really getting an answer. So I wanted to take that experience and translate it into something meaningful and actually develop a gold standard for the city. So if somebody presents to our office with any type of pain, we should be able to figure it out. We should be able to turn it off.
And that's the good news, because a lot of people, if you've had back pain or someone you love has had back pain, maybe you go to different people and hear a different story every single time.
Yeah.
Some people think that surgery is the only option. You do something called spinal cord stimulation, or SCS. What is it and how does it work?
Yeah, so you know, the ideal person is going to be someone who's trying to avoid a back surgery, they've got a chronic nerve type pain, or they've already had back surgery and are still hurting. So essentially, this therapy acts like a noise-canceling headphone to silence out those pain signals and let you get back to your quality of life.
And those pain signals are coming from, I'm guessing, the nerves that are sometimes like pinched or,
Yeah.
you know, having other pressure put on them?
Very good. So there's 3 different information highways that go up the spinal cord, so to speak. One of those keeps firing chronic nerve pain fibers. So we intercept that signal and replace it with a normal nerve signal.
Who is a good candidate for a procedure like SCS?
So I think the perfect person is going to be those individuals who might have already had a spine surgery and are still hurting, which unfortunately is a large percentage of those who have undergone spine surgery. But it also can apply to people that have specialized nerve type pain patterns. We just find the nerve and turn it off.
And are you focused on people who are dealing with chronic spine pain? What about someone who maybe threw their back out a month ago and they still haven't been able to find relief?
So that person's not going to be a candidate for a spinal cord stimulator.
Got it. You're looking for people who have had long-term issues.
For the stimulator. But if it's a acute pain or something that just recently happened, we can offer them maybe a little cortisone injection to accelerate their physical therapy program.
Got it.
Yeah.
And when you are seeing people walk in to your offices, you now have how many locations? Woodlands, Humble, Heights. What's the last one?
We're now in Baytown.
In Baytown as well. All right. So you're all over the Houston area. Who are you seeing walk through the door? Is there a specific, is it typically older people? Because younger people have back issues as well.
You know, mainly we're seeing those that are 55 plus that have gone to other specialists, and those other specialists have said, you know, it's probably not in our wheelhouse. However, that may not always be the person. If you're dealing with some type of a nerve pain, back pain, neck pain, we have the answer.
What about downtime? Because for anyone who has been out there and they've had a back surgery and they've been frustrated to find out that their pain just really did not go away,
Yeah.
a lot of people, do you find, are hesitant to try something new?
I think, unfortunately, if you've had an experience like that, it maybe makes you a little gun shy. But take solace in knowing that these small therapies are pretty quick, minimally invasive, and almost no downtime.
Almost no downtime. So for someone to get back to work or back to their daily routine?
Maybe about a week or 2.
Okay. Okay. Well, doctor, thank you so much for coming in. And it seems like getting back to the things we love to do, that really is the goal of your practice.
Absolutely. 2 things. 1, nobody in pain should wait. So we want to make sure we can get you in right away. We've got 2 nurse practitioners that can see you the same day, if not the same week. And then we'll get you a procedure done within that same week or next week if need be.
All right. Well, if my back pain from kickball doesn't go away, I'm going to be giving you a call. Thank you so much for stopping by. It's great to see you. And a reminder to our viewers, you can give AK Pain and Spine Center a call, 281-896-0013. They have locations in the Heights, Humble, Willis, the Woodlands, and now Baytown. The first 25 callers will receive a totally free screening. You do not need to be seen today, but call today. The website is akpainandspine.com. And as always, you can tell them Houston Life sent you.